for X-ray checkup if prescribed by the physician. Then after that, connect the distal of the tube to suction. So we are going to connect this to the suction and draining bag adapter according to the purpose of the procedure. And after that, secure the tube with tape or with rubber. Secure na natin ang safety pins to the client's gown and dispose contaminated materials to the proper container and wash hands. So you have to dispose this all. Then position the client to a comfortable position. Then place the call light in an easy access or easy reach. Then return the bed to its original position. So I'm gonna return the patient to its original position. Excuse ma'am. Then remove all contaminated, remove all used materials and use gloves and provide, use clean gloves and provide hygiene and assist the client to a clean and nurse daily. So we're done with the insertion. So after that, so for the nasogastric tube feeding, we have to check the physician's order again. Then assess the bowel sounds of the patient. After natin ma-check kung ano yung order ng physician, then check the bowel sound by using a stethoscope. Then assess the client regarding the discomfort from the tube. So I'm gonna ask the client, so ma'am, okay lang po ba yung tube natin? No more irritation? So observe the insertion site for irritation. Then after that, for the planning, prepare the tube feeding at a room temperature. So ready na yung materials natin. Then obtain the articles or equipment needed and identify the client and explain the procedure. So ma'am, name po. So, today po feeding tayo po using the NG tube. Then, after that, na-explain na natin kay patient kung ano yung procedure. Then, place the client to a high Fowler position again. Excuse me. High Fowler's position is recommended para hindi mag-aspiration si patient. Then, check the tube for placement and patency. So we have to make sure na tama yung tube natin and nag-work siya. Then infuse the feedings by pinching the proximal end of the feeding tube. So we have to pinch natin siya. Then attach the syringe to nasogastric tube and aspirate the small amount of content. So attach, then aspirate a small amount from the tube. Then after that, we have to fill the tube and the lower portion of the tube. I-fill natin yung tube. Then after that, fill the syringe with measured amount of formula. So kung ano yung order sa inyo na amount ng formula na i-feed kay patient, yun yung ilalagay natin sa syringe and yun yung i-administer natin kay patient. And release the tube and hold the syringe at 12 inches. So we have to release it from its pinch. Then mag-release tayo ng feeding. Nasa 12 inches siya para hindi make sure na naka-raise yung tube natin. Then release. After that, repeat until the prescribed amount had been given. Then until instill a 30 ml of water. So using another syringe, I'm gonna instill another 30 ml of water to the NG tube and clamp the NG tube before all of the water is instilled. So assuming na instill na natin yung water sa tube natin, then ask the client to remain in Fowler's position. So, sasabihan natin si patient, remain lang po tayo ma'am sa position and for at least 30 seconds after the feeding para to make sure na nasa tamang position si patient. Then, after that, we have to do aftercare of the equipment and wash hands. So, tapos na tayo sa feeding, then I'm gonna we're done with washing hands. Then we have to evaluate the client's tolerance to feeding, evaluates client's response to tube feeding, and we have to observe client for complaints of nausea and vomiting, and record amount, type, and time of feeding, and we have to document the client's response to tolerance of the tube feeding. Okay lang po, ma'am. So, stay lang po tayo sa position natin na after ng 30 minutes, pwede na po kayo humiga. So, we're done with the NG tube feeding. So, after that, we have to proceed for the removal of NG tube. So, first, we have to verify the physician's order, gather all equipment needed, and explain the procedure to the client. So, check. Then, gather all equipment. We have the towel, we have tissue, we have the container, we also have the tape, and a syringe. So, after that, elevate the bed and assist the client on a high Fowler's position. So, naka-high Fowler's na si patient. Then, wash hands and use a disposable Don gloves or disposable gloves. So, we have here the disposable gloves and we're gonna place it to the patient, such as ni patient. And place the amazis basin to the patient para ma-ready na tayo sa removal. Then, attach the syringe and flush the tube with 10 ml water. So, attach syringe. Attach the syringe with the 10 ml water. Then, carefully remove the adhesive tape from the client's nose. So, tapos na tayo sa 10 ml water. Then, we have to carefully remove the tape from the patient's nose and instruct the patient to take a deep breath and hold it and clamp the tube and fingers by doubling tube on itself. So, ma'am, hinga ng malalim. Then, after removing the tape, then quickly and carefully remove the tube with the client hold breaths. Using this tissue, I'm gonna remove the tube carefully. And then, clean and dry the face of the patient. Clean the patient, then dispose the tube and other equipment and properly according to the hospital policy, and dispose the tube and other equipment properly, remove gloves and wash hands, and document the procedure. So clean the nose of the patient, then dispose all the used equipments, then and record the procedure done. So we're done.